right, Justin, thank you so much for making time to talk. I think that everyone is going to really be inspired coming out of this discussion. So I'm just so grateful for you to offer your time and your experience.
Yeah, it's a pleasure to be here and be chatting with you.
Great. So one of the things that I thought we could just start with is you have a really interesting life story in terms of how you, you know, switched following your heart in terms of what you wanted out of practicing as a doctor. So I think that might be just helpful context to set the stage.
Yeah, no, thanks for that. I'll try to keep my life story relatively short. Otherwise, this will be an 8-part series. Um, so I never really thought I was going to end up being a doctor. It wasn't, a lot of people say since a little kid, I dreamed I would be a doctor. That wasn't really it for me. I loved science. I became fascinated with medicine once my grandfather actually was hospitalized. And long story short, he collapsed. They found out he had an adrenal bleed. They diagnosed the problem. They gave him hormone pills to function as his adrenal gland. And I thought that's so cool. Um, but I always felt a little bit of a disconnect with medicine. I had seen from family members suffering chronic disease that there was so much more to it than the condition, the doctor visits, the medications, and that the underlying psychology, how we relate to life, how we behave in life, played such an important role. And I sort of decided medicine was going to be bringing a lot of passions and gifts and what I wanted to serve the world. Um, Focusing on relationships, understanding science, being of service. But there was always a little something missing for me of that real deep humanistic piece. Um, and it
When you
wasn't
say
it.
that was always
Mhm.
missing, was that missing before you started medical school? Like just watching your, friends and family be part of the medical system and go through it, or was it actually when you started your training and started practicing?
It was a little bit of both. It was more something I couldn't quite put my finger on before I started training, and then it became more clear once I was in training. And when I was in medical school, it's like, oh, this physiology is great. I love the learning. And when it came to the practical application, again, it was, well, why does this person have this condition? Is there something more we can do about it other than just giving them medications, having them undergo procedures, discharging them from the hospital, when their edema goes away, and then coming back in for Lasix and that on repeat? So I was sort of searching for, is there some form of medicine that we can practice the evidence-based medicine and use the best of what Western medicine has to offer and bring in this behavioral component, this psychological component, this root cause oriented approach to actually get underneath the floorboards and clean them out instead of, just sweeping and mopping. And that's when I found lifestyle medicine. So it's not only been a lesson on how to practice medicine, but really how to live life. The way that the questions were being asked, a lot of times in medicine, we're detectives. And then what happened? And then this. And we can forget that we're dealing with a person who is scared, vulnerable, doesn't know what's going on, that has all of these other elements to their life outside of the symptoms and lab work that they end up presenting with. And, it was almost 10 years ago at this point, so I don't remember exactly what was said, but just in the way that the empathy was conveyed, in the way that the questions were being asked, in the manner of just true, genuine compassion and desire to help, while being willing to take this different approach to getting at the root of what's going on. And not just focusing on, okay, well, what's the diagnosis? What's the treatment? What's the ICD-10 code next?
The next step is like, okay, well, what do I offer you in terms of treatments? And, what counseling do I give you? And sort of what is the next way that we check in with each other?
Yeah, well, I think It's not just a matter of the treatments are different. It's a matter of that the whole approach is different. Because it might not even be, I'm digging into your symptoms in a particular way. Now, granted, this is situation dependent. If someone's presenting to the emergency room with chest pain, you're going to evaluate them for serious pathology first. So it does matter the setting you're in, and this detective-like questioning can definitely be applied. But I think it's, hey, what's important to you? What are you hoping that we can accomplish together over the course of a year, over the course of 5 years? What are your goals? What's your motivation? Tell me about your life. These sorts of big open-ended questions, even at the beginning, before we say, okay, well, you have hypertension, you have diabetes, you have hyperlipidemia, you need to lose weight, let's go down. It's like, okay, who are you? What do you care about? What are you looking for in life? What are your pain points? Starting there before we even say, okay, well, I'm going to offer you lifestyle instead of pharmacology for your hypertension, the whole person approach is something that can be started at the very beginning or even before a visit and shapes the entire way that care is given.
And integrative medicine, how they're different. I think after that, we can sort of start thinking from the patient's perspective, how they know which of these would be right for them, or how do they know when this is like more aligned with what they are really after.
Lifestyle medicine is the use of evidence-based therapeutic lifestyle interventions, like plant predominant nutrition, physical activity, stress management, positive relationships, sleep hygiene, avoiding risky substances, to treat and in some cases reverse disease with the goal of getting at the root cause. And it also happens to prevent. We need to have an informed consent related conversation of what are the costs and benefits of different treatment options. If you're expecting this, what generally we see based on the literature you have to put in terms of lifestyle changes to get the results you want. And if you're not willing to do that, that's okay, and we can find more of a middle ground. But the idea is really we're going to get at the root, we're going to look at the underlying pathophysiologic mechanisms, and we're going to use predominantly lifestyle changes as the foundation. If medications and procedures are warranted, not being against that, but that's not the first line for these chronic diseases that are mostly caused by lifestyle and can mostly be treated by lifestyle. So I can kind of paint two different conversations. Let's say someone is diagnosed with diabetes, type 2 diabetes. Mr. Smith, we got your lab results back, and unfortunately you have type 2 diabetes. The conventional medical establishment, this is a chronic progressive disease. It's probably a little bit genetic. Maybe it's because you're a little overweight. We need to put you on medication for it in order to reduce complications down the road, like heart attack, strokes, blindness, nerve pain. We'll see over time, we'll probably need to add more medications. You'll have to take the medications for the rest of your life. And our goal is really to keep your numbers down and stop the complications. And you should probably eat a little less and exercise more, and we can refer you to a dietitian if you want.
Yep, that sounds about right. That sounds like conventional medicine. Okay.
Versus in the lifestyle medicine approach, we'd say, Mr. Smith, based on your lab results, you have type 2 diabetes. This is something that if you're willing to work with us and you're open to it, in a lot of cases, we can reverse. We can induce remission in diabetes to make it where you can go back to having normal or near normal lab values without medication or with very minimal medication. Because the real cause of diabetes is insulin resistance, which is something that's very manageable with making lifestyle changes. It's caused mostly by lifestyle changes and therefore can be fixed mostly with lifestyle changes. We can also give medication that can help lower numbers and reduce complications, but that's not going to get at the root cause of why you have developed this condition in the first place and is more going to manage symptoms and manage complications rather than get at the root. Which approach would you like to take?
Great. That sounds about right. And I think that, I don't know, hopefully we'll get some feedback from the listeners, but I think that just very concretely puts the two conversations in the ways that they're framed side by side. So conventional medicine, you have this disease. These are the medications that treat the disease. These are the consequences of the disease as it's going to progress in you. And, you know, by the way, you can do these lifestyle modification factors totally at the end of the discussion and not really put in any tangible, concrete terms or as an alternative to the meds. Lifestyle medicine, hey, this is the disease you have. This is the understanding we have scientifically of why it happened. And we're opening up to you to think about yourself and why it happened and whether you want to try to reverse the lifestyle factors that are within your control to reverse, or if you would like to do that and supplement medicine or pursue medications alone for this.
Yeah, and it goes back to that informed consent piece.
Yeah.
Too often, I mean, a lot of times physicians, and I didn't know about this until later on in medical school and residency, that these chronic diseases are actually reversible. And it's not, lifestyle medicine, you know, we do a little, it can prevent it, but once you have it, it's too late. Or, you know, yeah, it's good to eat healthy and, you know, oh, you have high blood pressure, you need low salt. And we kind of stop there. But not realizing, hey, if we do a pretty intensive and radical change, which some people are willing to make, which we often don't believe that people are actually willing to make changes.
Pretty pessimistic.
If you're willing and open to making significant changes, which I and my team can help you with, we can make a dramatic impact on this disease while improving a lot of other parameters of your health, with really the only side effects being good ones. Or, you know, you can take this medication and I'll give you a more accurate of how much is this going to absolutely reduce your risk rather than relatively reduce your risk. What are the reasonable side effects? And let you make a decision of which path you want to go down. If you say, hey, doc, I'm not willing to change, give me the pill. You know, it's the patient's in the driver's seat of what they're willing and open to do. Our job is just to illuminate the different paths and then be willing to walk alongside them as they take them and continue to be
in a non-judgmental way and in an empowering way. What's so crazy to me is that, you know, it's very scientific. Like it's actually like being true to the scientific method of how diseases form to explain the patient how it formed. And it's kind of actually crazy to me that it's more in lifestyle medicine, which is sort of cast as like the less scientific or less data-driven evidence-based route, that patients are more likely to get that conversation about, wait, but like, why do I have this disease? Like, explain to me what we know. And of course, we don't know everything. And some of the things that we think we know, we'll find out later are wrong. But, you know, like that's like what we know about how insulin resistance develops, how metabolic syndrome develops, you know, is based on experimental and, you know, scientific method driven processes. And it's just like, it seems to me like so wrong to just kind of skip that step.
Yeah, and I think it's also that there's sort of a deeper level of the understanding, you know, from what I've learned doing lifestyle medicine in the underlying pathophysiology beyond just what we're taught up here. And it's the paradigm. If we're in a more pharmaceutical driven paradigm, we're going to be understanding things from a more pharmaceutical lens of, okay, well, what receptors are involved? And okay, then we can block this, and then that will affect this downstream, instead of being willing to pull back further and say, okay, what role does stress have in this? What role does nutrition have in this? And it's less of this reductionistic, let's just change one variable at a time and see what happens, and more holistic, which that term has gotten a bad rap. That's a different conversation. But a true whole person, whole picture approach where we say, you know what? I don't know exactly how much this strawberry is going to change things. And, you know, this strawberry is eaten in the context of a whole diet, of a whole life with different levels of exercise. And I don't know exactly how this is going to affect things. But I do know big picture that if we put in these elements based off of a whole host of literature, that you're likely going to get better.
Yep.
But in medicine, we want to say, nope, I know it's this receptor, and if I block it this much with this half-life, then this will happen. But our bodies are not just a collection of receptors,
Right.
there's
But
synergy.
in sort of Flexner report medicine, I don't want to give permission for like medicine to be sort of reduced down to just essentially what the a certain medical school curriculum is, because I think medicine is such a bigger term than that. But I know what you mean, but I don't know. I want to start a like we take that term back and we say like this is this kind of medicine. You know what I'm saying?
Yeah, I mean, really, and I learned this recently, the Latin term for doctor actually means teacher. And for a long time, the profession of medicine is how can we teach people how to live a healthy life?
Mm-hmm.
How can we empower them, guide them, be that educator? And then somewhere along the way, it became the
Treat.
prescription pad.
Exactly.
And again, I'm not knocking Western or conventional
You
medicine.
need
It's
to treat
all
something,
about
but
it's
it's so
all
only
about what tools do we have and what's the job.
exactly. I mean, I
And
don't know. I take a. Oh, please finish. Go ahead.
oh, I was going to say, if I've shattered my femur, I need an orthopedic surgeon. Full stop. That's the right tool for the job.
Right. Lifestyle
If
and
I have pneumonia, I need an antibiotic. That's the right tool for the job. If I have diabetes, which is a more complicated metabolic disorder that has much more at stake than, this receptor's off or this pathway is off, I need a different tool for the job. And the tools we use for acute disease and the tools we use for chronic disease need to be different, but we've sort of regressed to just using one type of tool for almost everything, and it's the right tool for the wrong job.
yeah, I think that like probably deserves highlighting that a doctor who practices lifestyle medicine has done all the same training as the conventional Western medicine doctor. So they have all of that, and then they're basically adding something on top. And another way to frame what you just said is that our definition of medicine that we're proposing is not to take away antibiotics or surgery or any of these evidence-based interventions that make sense, but to basically recognize that the limitations of those interventions and to basically have a bigger picture of, what is the most effective cure for the problem that you're dealing with, which is sometimes not something that one time a drug or one time a surgery is going to fix.
Yeah, it's really, and I didn't come up with this metaphor or the graphic, but it's really flipping the pyramid of care. That right now, the biggest part of our pyramid is in conventional medicine is medications and procedures. And the little bit we do is making lifestyle changes. And even though lifestyle changes are first line therapy, they're not really given first line priority in how people are trained, how people are reimbursed, what we typically think of in a physician patient relationship. So it's not saying, lifestyle medicine is not saying take medications and procedures out of the pyramid. It's saying let's start with a core foundation that no matter what's going on, we're going to address the lifestyle underlying physiological factors and focus on the least invasive, most beneficial, least harmful treatments at the core. And then there are going to be cases where we need evidence-based supplementation. There are going to be cases where we need medications, procedures, surgeries, etc. And that's fine. But we don't start there. And even when we do those things, we're still also focusing on that base of lifestyle medicine. Okay, you had a heart attack. You need a stent right now. Necessary life-saving procedure. And we're not going to stop there. Once you're stabilized, we're also going to zoom back and say, well, why did this happen in the first place? What can we do to prevent this from happening another time? What are your risk factors? How can we effectively treat you as a whole person and have that as the foundation? Not saying don't get a stent, because that would be non-evidence-based and extremely harmful.
Yeah. That's great. We forgot to define integrative medicine. I want to do that fast. And then I want to talk about some of the, I think, common sort of like detractors or points of skepticism. But I want to make sure we get our definitions covered.
Yeah. So integrative medicine, I'm less familiar in the integrative medicine space than the lifestyle medicine space. So I'll start with that caveat. And I think integrative medicine is a little more broad. Integrative medicine still has that root cause approach. It brings in some of the more complementary and alternative therapies as well in combination with Western medicine. So things like acupuncture, Tai Chi, supplementations, energy work, some of the things that we don't think of conventionally with Western medicine. Some of those things have a strong evidence base behind them. Some don't have quite the scientific rigor behind them, but what do they say? Absence of evidence is not evidence of absence. But integrative medicine brings in some more of those tools, still has that holistic approach, still does focus on lifestyle. But lifestyle medicine, it's really, hey, we're going to focus on the lifestyle behaviors front and center. And some cases in integrative medicine, this is where it really depends. It's instead of a pill for your hypertension, it's a supplement for hypertension. And sometimes in integrative medicine, it's, hey, let's take a root cause approach. Let's get to the bottom of it. So people can sort of use that term differently. But to me, it's a little bit of a broader term, a little bit of a broader field. But there might be some integrative medicine people out there that said, no. So I'm much clearer on the lifestyle medicine definitions there.
Because that's the fellowship that you were in when I first met you, right?
I was doing some extra training in lifestyle medicine. It wasn't quite a lifestyle medicine fellowship, but I've been really involved with American College of Lifestyle Medicine for several years, and that's sort of been my niche where I've been going to. Not saying that's the only one people should look into. It matters what's best for everyone else, but that's what I'm more familiar with than integrative medicine. So
yeah,
that's kind of my lane.
Yeah, totally. That's great. So detractors and skepticism and I think just challenges. Who are some patients who you have seen who tried lifestyle medicine and really did not like it? It really didn't work for them. Who are some people who you think you would just advise like, hey, this is not the path for you?
So I think what's most common is people think that they've tried it, but they've been underdosed, incorrectly sort of diagnosed and led down a particular pathway. And then they say, it doesn't work, nothing works, it must be genetic. So, I was diagnosed with diabetes and I cut back on my carbs and it didn't help and I gained weight and I don't think diet has anything to do with this. Or I had high blood pressure and, I walked twice a week and I cut back on my salt at the table and nothing happened and I didn't get better and I'm still on these pills. Just give me more pills. So I think that's probably the most common thing. And that's really not the fault of the patient or the responsive. We often don't paint the right picture. And it might say, oh yeah, the following this diet might help a little bit, but not, oh, well, if you want those results, we need to really dig in. What are you eating? And you think you're eating healthy, but oh, for breakfast, I just have coffee. Oh, well, what's in the coffee? Oh, well, heavy cream and 6 sugars. Really getting deep into what are the actual lifestyle behaviors that are going on. What does the patient understand is healthy versus not healthy? Teaching them what is truly healthy, and which is different than what we learn in medical school a lot of the time. And then giving people the right support to make those changes. That can be dramatically different. So most of what I see is, oh, I tried that lifestyle stuff and it didn't work. But it's not the lifestyle stuff that didn't work. It was the wrong dose, wrong advice, incorrect assessment of what was going on. So that's probably the most common from what I've seen. As far as patients who it's like, hey, we should just give medication to, that's not really my place to judge. And I think that's where we also fall into a trap of, it's like, I don't think this patient's going to do it. And we're taking their autonomy away from them when we do that. We can have our judgments, we can have our assessments. It is important to think like that as clinicians. But I always use this example. If someone had cancer and the first line therapy was surgery, and we said, oh, I don't really think that they're going to do well with surgery. I don't know that they're going to follow up. I'm just going to tell them to do chemo. You would get sued, lose your license, be on the front cover of the newspaper. But we do that all the time with lifestyle changes. We think that people can't do it, so we kind of don't really tell them or don't paint it in the right way. So I think the main patients that we should just give medication to and not focus on lifestyle are the ones that say, I just want medication, I don't want to focus on lifestyle. Meeting people where they're at is extremely important, and educating them effectively on what their options are extremely important. And a great physician mentor of mine said, teach 100% and then meet them where they're at. So I can say, hey, what level do you want to improve your diet? If your diet's at a 2 right now, how high do you want to get it up? Okay, a 5. Let me tell you what a 10 would be like. And then you can kind of see how much you align with that, if that's something you'd like to do, if that's unreachable for you because of environmental factors, social factors, etc. But let me tell you what optimum would be. So now you can make an informed decision. It's not saying, well, you're not going to do optimum. Well, you're going to be sick. I'm not going to take care of you. Judgment. It's not about that. But we need to be giving people the right information so they can make their own informed decision. And then if they say, hey, I'm not willing to make a change here, I'm not willing to make a change here, but I am willing to make a change here, and it's a small one, great, let's start there. And that's where the motivational interviewing comes in. That's where the compassionate, getting to know someone, doing that real patient-centered care, and having that approach to it. And also, I do have this knowledge and information about what tends to produce optimal health, generally speaking. And if I don't share that with you, then I'm withholding important information that you might use to make a decision for yourself. Mm-hmm. So it's really not one or the other. The meeting where they're at's important, and the telling them the facts is important too.
Yeah, I think that was a great example for you to give, because I can see from that example how much harder this is than just sort of skipping that conversation. As soon as you said, where's your food, at a 2, you wanted to be at a 5, should it be at an 8? I felt defensive if I were the patient. I felt thinking to myself, what if this doctor doesn't have my cultural background and they think that like the food of my culture, of my ancestors that I really enjoy is intrinsically a 2, because it's not like this, basically in my head, like white person, California diet that's plant-based and vegan, and obviously this is all on the practitioner, and there's an art here to, what a 10 looks like and how a person feels about, what grade they're giving themselves. But as soon as you wade into the really messy parts of their life that are not going well, that are making them sick, that's a really, really hard place to be, and it takes a lot of trust, and you can get in dangerous territory really fast.
I usually ask people, how would you rate your own diet? Yeah. Why is it not lower? Why is it not higher to you? And it's really starting with, where's the patient at? In part of meeting them where they're at, you have to know where they're at. So, okay, you told me this diet, and you think it's an 8, and you think it's an 8 and not a 6 because of this, and it's an 8 and not a 10 because of this. Now I have at least a little bit of an understanding, and I like to ask, who cooks in the house, and where do you get your food from, and asking about food insecurity, asking, are there particular favorite foods, least favorite foods, what do you like, what you don't. Taking a really thorough dietary history, again, when you have the time to do so. And then, hey, I noticed that you thought that these foods were healthy, or that these foods were that I shouldn't eat fruit because I have diabetes. Is it okay if I share some information with you about that? And that's, you're asking permission. So it's not, did you know that fruit's fine for you? And how could you not know? It's, can I share some information with you? And when we make assumptions, that's when we get into dangerous territory. So if we can have that respectful conversation, and if someone says, no, I tried that, that didn't work, to explore that and not assume that we know everything because we're the physician, because we don't live the patient's life for them, and also be willing to share our expertise and what we do truly know. And it's really a balance, it's nuance, it's the way we communicate, not only the words we use, but how we hold ourselves. And that's where keeping that open, compassionate, caring place and developing that strong relationship has to be the foundation.
From a sort of society standpoint of, we just don't have the resources to be this in-depth with every patient. These appointments would take too long if we asked them about all the different foods that they ate and tried to coach them through these, changes in their life. That's not the job of a doctor. And it takes too much time, and it would be too expensive, and our healthcare system can't support that. What would you say in response to that?
Well, there's some truth there, but there's not 100% truth there. The first thing I'll say is our job is to do the best we can given our circumstances. Okay, if you have this amount of time, these resources, etc., what can you reasonably do during that time to make a little bit of a difference? But you can say, hey, diet is really important to your health. I'd have a handout that you can look into diet if you're interested, and spend 6 seconds doing that and give them a handout. And that would be better than not doing anything different.
How you found your own path as a doctor with all of these, competing kind of demands on your time and options you can pursue, or, to a patient who's watching this.
I think for physicians that we're our first and most important patient, that it's very easy to be outward focused, and we should be of service. And I'm not saying be selfish and only care about yourself, but we have to take care of ourselves. And especially with this lifestyle medicine, practicing what we preach or making a valiant attempt is very important. We don't need to be perfect. We don't need to have an idea to show our patients, hey, this is important enough where I'm actually going to do it. I'm going to do the things that I'm telling you to, and I'm going to struggle with them. And that's going to give me humility and empathy when I talk to you and say, oh, just exercise more. Well, I'm busy. It's like, oh, wait, yeah, I'm busy and I don't exercise. And the more we take care of ourselves, the better we're going to be able to show up for everyone else in our life. The more full our tank is, the more we can share with others, the more we can be of service, the more we can spread love with others, the more we can heal others. Our health is important too. We're not immune from metabolic disease just because we have a degree. It's so important for us to take care of ourselves, and that can have a more profound ripple effect than anything we say in our business.
I think we should end on that. That sounds like
excellent.
great. Thank you so much, Justin. Really appreciate it.
Yeah, thank you. Great to be here.